Hello, everyone. Bonjour à tous. Welcome and thank you for participating in today's update on COVID-19. Today, bienvenue à la mise à jour sur la COVID-19 au Canada. Today, we will hear remarks from Dr. Theresa Tam, Dr. Howard Njoo, and Brigadier-General Krista Brodie from the Public Health Agency of Canada. They will be accompanied by Joël Paquette from Public Services and Procurement Canada to answer questions. Aujourd'hui, nous entendrons des allocutions du Dr. Theresa Tam, du Dr. Howard Njoo et du Brigadier-Général Krista Brodie de l'Agence de la santé publique du Canada. Ils seront accompagnés par Joël Paquette de Services publics et Approvisionnement Canada pour la période de questions. Following the remarks, we will open the teleconference line for questions from the media. Suite à la présentation, nous répondrons à vos questions. If you wish to ask a question, please press star 1 on your phone. Si vous désirez poser une question, veuillez appuyer sur étoile 1. Procédons à la séance. Let's begin. Over to you, Dr. Tam.
Bonjour à toutes et à tous. Nationally, we continue to make good progress with all 7-day rolling averages steadily declining. The average national case count has dropped more than 80% since the peak of the third wave to under 1,550 cases reported daily. Likewise, the average number of people with COVID-19 being treated in our hospitals each day has dropped almost 60% since the peak to less than 1,850 daily. Of these, on average, less than 800 were being treated in intensive care units, which is down more than 45% from the peak. And average daily deaths are down 40% to 31 deaths being reported daily. As of today, over 27.7 million doses of vaccine have been administered across Canada, with over 2.6 million doses of COVID-19 vaccines given in the past week. As of June 4th, 70% of the eligible population aged 12 years or older have received at least one dose of COVID-19 vaccine, and 9% have received 2 doses. Notably, Indigenous communities and the territories continue to have some of the highest vaccination coverage rates in the country. For example, as of June 7th, over 72% of people 12 years or older living on reserve have received at least one dose of vaccine. In the territories, 71% of the population 12 years older have received at least one dose, and 60% are fully vaccinated. As Canada steps into the vaccination fast lane, there is a lot for us to take pride in. In particular, despite the long, difficult haul of this pandemic, Canadians have continued to show kindness and creativity in supporting others, including building vaccine confidence. 20 finalists announced earlier this week as part of the Vaccine Community Innovation Challenge exemplify the many community-based initiatives that are doing this great work. The challenge called for innovative, community-driven proposals to help strengthen COVID-19 vaccine confidence in Canada and reinforce public health measures. Specifically, these projects encourage individuals and organizations to extend the reach to community members using different languages and culturally appropriate ways to convey the importance of getting vaccinated against COVID-19. One example of a finalist is an Indigenous community project that will use humor to reach its tight-knit, semi-remote community. The finalists will each receive a grant to develop and implement their unique campaign initiatives in communities across Canada. Let's keep working together, steady on the path to get back to the things we miss, safer and sooner. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous. À l'échelle nationale, nous continuons à faire de bons progrès, comme l'indiquent les moyennes sur 7 jours, qui sont en baisse constante. Le nombre moyen de cas à l'échelle du pays a diminué de plus de 80% par rapport au pic de la troisième vague et est passé sous la barre de 1550 cas déclarés par jour. De même, le nombre moyen de personnes atteintes de la COVID-19 traités dans nos hôpitaux chaque jour a diminué de près de 60% depuis le pic pour atteindre moins de 1854 par jour. Parmi ces personnes, en moyenne, moins de 800 ont été traités dans des unités de soins intensifs, ce qui représente une baisse de plus de 45% par rapport au pic. Notons aussi que le nombre moyen de décès quotidiens a diminué de 40% pour atteindre 31 décès déclarés par jour. À ce jour, plus de 27,7 millions de doses de vaccins contre la COVID-19 ont été administrées au Canada, dont plus de 2,6 millions au cours de la dernière semaine. Le 4 juin, 70% de la population admissible âgée de 12 ans et plus avait reçu au moins une dose de vaccin contre la COVID-19 et 9% avaient reçu 2 doses. Il est à noter que les communautés autochtones et les territoires continuent d'afficher des taux de couverture vaccinale parmi les plus élevés au pays. Par exemple, le 7 juin, plus de 72% des personnes de 12 ans et plus vivant dans les réserves avaient reçu au moins une dose de vaccin contre la COVID-19. Dans les territoires, 71% de la population de 12 ans et plus ont reçu au moins une dose et 60% sont entièrement vaccinés. Alors que le Canada procède rapidement à la vaccination, nous avons de quoi être fiers. En particulier, malgré le long et difficile périple qui représente cette pandémie, les Canadiens ont continué à faire preuve de bonté et de créativité pour aider les autres, notamment en inspirant la confiance dans la vaccination. Les 20 finalistes annoncés plus tôt cette semaine du défi de l'innovation communautaire des vaccins témoignent des nombreuses initiatives communautaires qui visent à accomplir ce travail remarquable. Dans le cadre de ce défi, les participants devaient faire des propositions novatrices axées sur la communauté pour aider à raffermir la confiance envers la vaccination contre la COVID-19 au Canada et à renforcer les mesures de santé publique. Plus précisément, ces projets encouragent les personnes et les organisations à sensibiliser les membres de la communauté en utilisant différentes langues et des méthodes adaptées à la culture pour communiquer l'importance de se faire vacciner contre la COVID-19. Parmi les projets des finalistes, une communauté autochtone fera de l'humour pour joindre sa communauté très unie et semi-éloignée. Les finalistes recevront chacun une subvention pour élaborer et mener leur campagne unique dans les communautés partout au Canada. Continuons à travailler ensemble de façon continue pour retrouver les choses qui nous manquent de manière sûre et le plus rapidement possible. Merci. Thank you. Miigwech.
This week, we are completing the deliveries of vaccines to the territories. This means the Northwest Territories, Nunavut, and Yukon will have the vaccine supply needed to fully vaccinate their eligible population, 12 years of age and up. This achievement is a significant milestone in Canada's COVID-19 vaccine distribution strategy. In consultation with federal, provincial, territorial, and Indigenous partners, a decision to prioritize the North was made at the outset to support vulnerable populations in isolated communities with limited access to healthcare services. I want to thank everyone who has been involved in the distribution process since the start. We will continue our work until there are enough vaccines for Canadians to be fully vaccinated in the greatest possible numbers. To date, we have delivered close to 32 million doses of COVID-19 vaccines across Canada. The delivery of 2.4 million doses of Pfizer-BioNTech was completed earlier this week, along with ongoing deliveries of nearly 100,000 doses of Moderna. As announced earlier this week, we are tracking to distribute 7 million doses of Moderna by the end of the month. These shipments will be coming from the United States, and we are working to finalize regulatory and logistical arrangements in the coming days. We expect a shipment of 2.9 million to arrive in Canada on June 16th for distribution commencing the following day. We are anticipating a further shipment of 4.2 million to arrive the 18th of June for distribution the week of 21st June. Our distribution tempo keeps on increasing, with more than 40 million doses scheduled by the end of June and solid supply throughout the summer. Cette semaine, nous complétons toutes les livraisons des vaccins au territoire. En d'autres mots, les territoires du Nord-Ouest, le Nunavut et le Yukon reçoivent toutes les quantités de vaccins nécessaires pour assurer la pleine vaccination de leur population admissible de 12 ans et plus. Cette réalisation représente une étape significative dans la stratégie canadienne, la distribution des vaccins contre le COVID-19. En consultation avec les partenaires fédéraux, provinciaux, territoriaux et autochtones, une décision de prioriser le Nord a été prise dès le départ pour soutenir la population vulnérable dans les collectivités isolées où l'accès aux services de santé est limité. Je tiens à remercier toutes les personnes qui ont participé au processus de distribution depuis le début. Nous poursuivrons le travail que nous avons amorcé jusqu'à ce qu'il y ait suffisamment de vaccins pour que le plus de Canadiens et Canadiennes soient entièrement vaccinés. À ce jour, nous avons livré aux alentours de 32 millions de doses de vaccins contre le COVID-19 au Canada. La livraison de 2,4 millions de doses de vaccins Pfizer-BioNTech a été complétée plus tôt cette semaine. Et la livraison de près de 100 000 doses Moderna est en cours. Comme annoncé plus tôt cette semaine, nous prévoyons de distribuer 7 millions de doses de Moderna d'ici la fin du mois. Ces envois arriveront des États-Unis et nous finaliserons les dispositions réglementaires et logistiques dans les prochains jours. Nous prévoyons l'arrivée au Canada de 2,9 millions de doses le 16 juin, qui seront distribuées les jours suivants. La livraison suivante sera de 4,2 millions de doses, qui arrivera le 18 juin pour distribution la semaine de 21 juin. Notre cadence de distribution ne cesse d'accélérer avec plus de 40 millions de doses d'ici la fin du mois de juin, ainsi qu'un approvisionnement constant tout au long de l'été. Merci. Miigwech.
We will now open the phone lines to questions. We ask that you limit yourself to one question and only one follow-up. We will be taking your questions in both official languages. Nous vous demandons de vous limiter à une question et seulement une question suivie. Vous pouvez poser vos questions dans l'une ou l'autre des langues officielles. We will start with the first question. Première question, opérateur.
Thank you, merci. Our first question, la première question, Marieke Walsh de Globe and Mail. Your line is open. À vous la parole.
Good afternoon. I'm wondering if Madame Paquette, I think, could give us an update on what is happening with the delivery schedules for AstraZeneca and Johnson & Johnson. I know Johnson & Johnson still is going to have a statement out today on the decision from the FDA and Health Canada, but if you could just give us an understanding of the doses we're still expecting from them this month. It was my understanding we were supposed to get another 1 million from AstraZeneca, as well as outstanding amounts from COVAX and the Serum Institute. So if you could just give us an understanding of where those things stand.
Thank you for the question. So on COVAX, we do not have the detailed information on the next shipment. On the Serum Institute of India, at this time, that is still on hold, given although the situation is getting better in India, there is still a hold on the vaccines coming from that particular supplier. And AstraZeneca on our 20 million advance purchase agreement, the first shipment is due the week of the 28th of June of 1 million. I can let General Brodie provide a little bit more detail on that. On the Johnson & Johnson vaccine, we have the 310,000 that came earlier. That is still on hold pending Health Canada approval. And they have advised that they will have a shipment at the end of this month, but further detail will be provided once we solidify that. So, General Brodie, I don't know if there was anything else that could be said.
Thank you. I can add that we're working very closely with the provinces to determine their requirements, both for AstraZeneca and for Janssen, as they continue to support their vaccine campaigns, and look forward to being able to provide an update in the coming weeks as we refine those requirements against the arrangements that Joelle discussed. Thank you.
Okay, thank you for that. Just following up on that, the Health Committee was told, I believe, a few weeks ago that there would be a shipment from COVAX this month. So is that now in doubt? And how much specifically is expected in the next J&J shipment this month?
So as I said, the COVAX shipment, we get that information very close. It's a little different than our APAs in how we manage that information, because we receive it very close to the time of the shipment. So unfortunately, I can't give you any additional detail on that particular COVAX shipment that is expected in the month of June. On the Janssen or Johnson & Johnson vaccine, they have informed that they're looking at around the 300,000 at the end of this month. But again, we're working with the Public Health Agency and the provinces and territories on the next steps. Thank you.
Merci beaucoup. Prochaine question.
Thank you. Merci. Our next question. La prochaine question. Christian Noël, Radio-Canada. Your line is open. À vous la parole.
Bonjour, merci de prendre nos questions. Je me demandais, concernant justement les livraisons qui pourraient survenir, notamment des États-Unis, qu'est-ce que vous pouvez nous dire au niveau de la logistique et au niveau des ententes où on est rendu là-dedans?
Merci. Si vous parlez du commentaire qui avait été fait par le gouvernement américain, nous travaillons toujours avec le gouvernement sur la possibilité de recevoir des doses supplémentaires au Canada. Et lorsque nous aurons plus de détails sur le nombre de doses et le genre de doses, à ce moment-là, nous pourrons vous donner plus d'informations. Merci.
Merci. Si on regarde le fait aussi que les territoires vont avoir reçu toutes leurs doses déjà, je me demandais à quel point c'était un développement significatif pour la protection du Nord avec la priorité qu'on y avait mis. Et l'autre chose aussi, quand on regarde les projections et quand on regarde le rythme de vaccination, il semble que l'objectif des provinces va être atteint avant même le mois de septembre. En quoi est-ce que c'est significatif de votre côté?
C'est Dr. Njoo. Peut-être je peux commencer avec peut-être la question concernant la couverture vaccinale. C'est toujours, comme on dit, un objectif d'avoir 75% de la population vaccinée avec les 2 doses. Et ce qu'on a déjà constaté, que dans les territoires, ça va très bien avec leur programme de vaccination. Je pense que c'est 71% maintenant de toutes les personnes âgées de 12 ans et plus qui ont reçu au moins une dose et 60% entièrement vaccinés. Mais je pense même avec un objectif de 75%, pourquoi pas plus que ça? Donc, je pense qu'on continue de travailler étroitement avec les autorités sanitaires des territoires et aussi avec toutes les provinces et territoires, après avoir peut-être atteint l'objectif de 75% de la population pour la couverture vaccinale, on continue de travailler, comme on a déjà constaté, de vacciner le plus grand nombre de Canadiens admissibles pour une vaccination plus rapidement possible. Pourquoi pas 80, peut-être même 100% si c'est possible. C'est toujours quelque chose à suivre, mais pour les territoires, on est toujours sur la bonne voie.
J'aimerais juste ajouter que notre objectif est vraiment de s'assurer que les doses soient livrées au Canada le plus rapidement possible. Et à mesure que les vaccins continuent d'arriver, c'est-à-dire les vaccins continuent d'arriver au Canada à un rythme régulier. Et donc, je peux vous assurer qu'on est sur la bonne voie d'avoir un approvisionnement suffisant pour atteindre notre objectif de vacciner tous les Canadiens admissibles d'ici la fin de septembre. Donc, nous continuons avec cet objectif. Merci.
On avait une stratégie et maintenant, on a atteint cette stratégie. Donc, le Nord, les territoires ont toutes les doses dont ils ont besoin après les livraisons de cette semaine pour faire leur programme de vaccination, y compris la deuxième dose. Donc, c'est vraiment un bon moment pour le programme de vaccination dans le Nord et pour le Canada.
Merci beaucoup. Next question. Prochaine question.
Thank you. Merci. Our next question, la prochaine question, Mia Rabson, the Canadian Press. Your line is open. À vous la parole.
Hi, Dr. Njoo. Just wondering if you could build on your last answer a little bit where you said, why not aim higher than 75%? And I'm wondering what data we have at this point on what the barriers are to beyond that. Do we know sort of where there are pockets of hesitancy, and what are we doing to try and address that?
Okay, thank you, Mia, for the question. I'm sure Dr. Tammy chip in as well, but you're right. When we gave our presentation, I think a few weeks ago with the modeling, I think a lot of people were fixated on the so-called 75% one dose and then 20% with two doses as an indicator for potential, I should say, loosening public health measures. We've also indicated that it's not just the vaccine coverage, but it's also linked to obviously what's happening in the community and also what the impact is on the healthcare system. If all the indicators are trending in the right direction, then certainly, provinces, territories, and which are doing right now, can open up, more and more. So that's, I think, what everyone's hopeful for the summer. But in terms of vaccine coverage, I think the more people that are covered, the harder it is for the virus to continue to sort of propagate and spread throughout the population because there's more, I would say, collective immunity, herd immunity. So I think that's something we're very alive to because we do recognize that no vaccine is 100% effective. So really, I think it's an artificial target in some ways, and we're trying to, as we've always said, vaccinate as many eligible Canadians as quickly as possible. And we're aiming, obviously, towards the end of the summer with what we're seeing in terms of the regular schedules of arrival of vaccines and the administration by provinces and territories. Based on what we're seeing around the world, certainly the experts are still discussing what might be sort of at least a minimum or optimal sort of herd immunity, and it's somewhere 70-75%. But especially now with the I think the emergence of variants, including Delta variant, I think it just underlines the point that it's so important for everyone to realize that one dose doesn't do it. You really need to be fully vaccinated, especially with the vaccine requiring two doses to get those two doses so that all of us are in a much better position of being protected against COVID-19. With respect to vaccine hesitancy, I would say that, yes, in some ways it's always easier to get the first 50, 60, maybe 70% even of the population covered, but we do recognize that with respect to vaccine hesitancy, that's been an issue that's been around even before COVID-19. We recognize that certain subpopulations, it might be a matter of access, and certainly we're looking at all of the different types of barriers to access, and maybe maybe a lack of information that could be at play, and therefore we're looking hard at how we address that. As we just mentioned in our opening remarks, certainly we have a very innovative approach in terms of funding projects at the community level, so that really it's peers talking to peers, and within certain groups culturally and so on, that hopefully will also increase what we call vaccine confidence. So all of those things, I think, are in play. But always where we keep looking at the issue, and with our provincial territorial counterparts, recognizing that there's still maybe some pockets. What more could we be doing in terms of reaching at those individuals? We're looking at social media platforms, all sorts of communication channels, but it's more than that. It's leadership. It's trusted leaders in certain communities also going forward and showing that they've been vaccinated, that they feel confident about why it's important to them and their families and their community. And hopefully, like I say, what we're seeing is a snowball effect. And I think as more and more Canadians get vaccinated, even with the 2 doses, I think it just increases the confidence overall. So I think it's all in the right direction.
Thank you. And I'm also wondering, Dr. Tam or anyone else, if you could weigh in a little bit on the debates that seem to be happening at the provincial level about when to give a second dose to people who got AstraZeneca. It seems to be all over the place depending on what province you're in. Ontario saying it has to be 12 weeks. Other provinces saying you can get it sooner if you opt for a second dose of AstraZeneca instead of mRNA. Just wondering if NACI has been asked to weigh in on this, and if you have any guidance for people as to what is actually best and what the data actually says about when that second dose should be given.
Yeah, so the National Advisory Committee on Immunization provided a number of different recommendations. Obviously, different intervals were looked at during clinical trials, and many of them were quite short. And then we had to rely on the millions of people that got vaccinated post regulatory authorization to look at vaccine effectiveness. But I have to preface this by saying that people haven't studied every single interval. So the data is not available for, every week, looking at each incremental week what the vaccine effectiveness is. What I can say is, first of all, there is a minimum interval. So that is actually quite critical, and they are slightly different for the different vaccines. So you shouldn't get the 2 doses too close together. So for Pfizer is 19 days, for Moderna is 21, and for AstraZeneca is 28. Don't go below that, because that can actually affect your priming and boosting interval, and that is something that people just have to be aware of. You can be kind of overly fast, if you like, or overly enthusiastic about getting that second dose. So keep that minimum interval. And then really what NACI said was up to 16 weeks. But if the supply is available, you can shorten that interval. And if obviously, if you have a Delta variant that is circulating in your community, then getting that second dose in is really important. And some provinces have looked at maybe homing in on some of their areas with higher incidence with that second dose faster. So it depends on local epidemiology. One vaccine that there is some information on is AstraZeneca. AstraZeneca seems to be more effective if you increase that interval from the baseline of 4 weeks to 12 weeks. So there's some data on that. But there's no data really from 8 weeks to 10 weeks to 12 weeks. It's a matter of balance of looking at, again, what your epidemiology in terms of trying to shorten that interval, and supply and other factors. So that's why there's some variation. But I think many provinces are going between somewhere between the 8 to 12-week mark for the AstraZeneca vaccine. But you would have to discuss with the local authorities. But so just remember this minimum interval, don't go below that. And then it's up to 16 weeks, but anywhere in between, there is not a massive amount of information on.
Thank you. Next question. Prochaine question.
Thank you. La prochaine question, our next question, Estelle Côté-Sroka, Radio-Canada. Your line is open. À vous la parole.
Bonjour, j'aimerais avoir des informations concernant l'éventuel partage de doses de vaccins avec des pays à l'étranger. Quels seront les critères qu'on va devoir atteindre au Canada en termes de vaccination, hospitalisation et autres pour en arriver à un stade où on va pouvoir, en tant que pays, être prêt à partager, à donner des doses de vaccins à d'autres pays?
Merci pour la question. Je comprends qu'il va y avoir plus de détails relativement à ce don qui va être communiqué prochainement. Et donc, je ne peux pas fournir l'information que vous recherchez. Ça vient d'être annoncé et il y a encore du travail qui se fait pour fournir plus d'informations à ce sujet. Merci.
C'est Dr. Njoo. Peut-être je peux ajouter quelque chose. Je pense aussi que c'est la priorité, c'est toujours ici au Canada pour offrir les 2 doses de vaccin à toutes les personnes admissibles ici au Canada. C'est toujours le but avec notre planification, avec la logistique, l'approvisionnement. Ça, c'est toujours la priorité. Mais c'est sûr qu'avec les contrats, tout ça, il y a beaucoup plus de doses disponibles et c'est pour les autres peut-être prendre des décisions pour partager, mais je pense qu'on a déjà offert des millions de doses en principe pour les autres pays, mais c'est sûr aussi que c'est très important d'avoir assez de doses ici au Canada pour les Canadiens et Canadiennes. Merci.
Je peux peut-être me permettre de vous relancer en 2 temps. À quel moment est-ce qu'on va savoir combien de doses le Canada va pouvoir envoyer à l'étranger? Puis peut-être revenir un peu sur ma première question. C'était peut-être pas clair, mais je voulais savoir en termes de critères scientifiques, à quel moment on va pouvoir donner le go pour partager des doses avec des pays qui n'en ont pas autant que nous. Donc, c'est possible de répondre à ces 2 points, s'il vous plaît.
Sur le montant, je crois qu'il y a eu une annonce sur 100 millions de doses qui vont comme don. Et c'est sur cela que j'ai informé qu'il y aurait plus de détails bientôt. Mais sur le côté scientifique, je ne suis pas en mesure de répondre.
C'est Dr. Njoo. Comme on a déjà constaté que on est toujours en train d'offrir les 2 doses de vaccin à tous les Canadiens et Canadiennes. Et je pense qu'on est dans une bonne position de faire ça, je pense, d'ici à la fin d'été.
Merci. Thank you. Prochaine question. Next question.
Thank you. Merci. La prochaine question, our next question, Annie Bergeron, Oliver, CTV National News. Your line is open. À vous la parole.
Hi, thank you very much for taking my question. I'm just going to follow up on what one of my colleagues mentioned about the interval for AstraZeneca. As I understand it, that longer interval based on the studies is best for a first and second dose of AstraZeneca. But a lot of people are now deciding that since it's allowed through NACI to switch to a Pfizer and Moderna. So given that the Delta variant is spreading, do you believe that Ontario should be shortening that timeline down from 12 weeks? Because right now, if you live in a hotspot like Toronto, you have Moderna or Pfizer, you're eligible for a second dose much faster. Those with AstraZeneca in those hotspots are still waiting a minimum of 12 weeks.
I can't comment on the details in Ontario, but I know that many jurisdictions are working between 8 to 10 weeks for their second doses. Some have harmonized that interval so that it doesn't matter which second dose you're getting. That's roughly the interval for the appointments. In terms of the actual technical information available on the mixed dose schedule is limited. In the study from Germany, when they looked at the AstraZeneca followed by an mRNA vaccine, they did it at just over a 10-week interval. So I think from a sort of expert opinion perspective, the chief medical officers across the country have thought that somewhere between that 8 to 10 week interval is probably something that they will be working with. But I think Ontario is a very big province. We have to sort of let them talk to you about why they're doing different intervals in different places.
Okay, thank you. And as my follow-up, some countries are looking at doing just one dose of a COVID vaccine for children and teens. Is this something that Canada is considering as well?
Well, I know that the National Advisory Committee on Immunization is looking at and following the data on all of this evolving information. I think, of course, one of the reasons is for the 12-year and up, which is the vaccine that's authorized at the moment, but also for the younger people, the younger kids that for which the clinical trials are ongoing. So I think one of the developing, I guess, evolution in the observation is one of the side effects that following immunization people are tracking now is the myocarditis or heart inflammation that's occurring at generally after the second dose in younger people, a few days after they've had their second dose. So while essentially people seem to be recovering from these fairly quickly, these events, it is something to be watching for. There is no specific recommendation to just go with one dose right now, and the regulator has not made any changes, but I know that they're all following this information very closely. For the younger kids, I think there's clinical trials using lower doses as well. So we'll have to also see what happens in those trials, and there's no specific recommendations for the younger kids at the moment.
Thank you. Prochaine question. Next question.
Thank you. Merci. La prochaine question, our next question, Ryan Tumulty, National Post. Your line is open. À vous la parole.
Yeah, I'm wondering if you can offer any greater clarity about the 300,000 doses of the Johnson & Johnson vaccine that Canada has basically in storage while we're waiting for this FDA review. The reports coming out of the U.S. today are that the FDA is calling for a lot of those doses that came out of that plant to be scrapped. I'm wondering where we stand with ours.
So currently our doses are still in quarantine. They still technically belong to the manufacturer, so pending a determination from Health Canada based on the information coming out of the FDA and other sources, we will, once a determination is made with respect to that which is sitting in Canada, we'll make a determination whether or not those are distributed or whether or not they're returned to the manufacturer. So we look forward to that determination.
Okay, and then I guess going forward, are we expecting that this problem won't emerge with future J&J doses? And also, given how relatively advanced our vaccine program has been now in getting first doses of mRNA vaccines, do we still see the J&J vaccine as playing a big role in Canada's rollout?
Well, it'll be up to the provinces to determine the role for J&J within their vaccination campaigns and within their portfolios. What I can indicate is that we are in the big lift now. So, next week alone, we're planning on bringing into the country 9.5 million doses of mRNA vaccines, and for which we have plans to distribute 5.3 million of those, and rolling over the 4.2 of that second Moderna shipment into the following week. So in the weeks ahead, there is a significant supply of mRNA vaccines to support the provinces and their vaccination campaigns, particularly as they look to advance those second dose strategies. For the territories, we've provided them with sufficient vaccine supply to meet 85% of their eligible populations. And if they need more, we'll ship more so that we can maximize the number of Canadians across the board who are eligible to be vaccinated as we follow Dr. Tam's advice and shoot for the stars.
Thank you. Next question. Question, question.
Thank you. Merci. Our next question. La prochaine question, Annie Guillemette de Cogeco Nouvelles 98.5 FM. Your line is open. À vous la parole.
Oui, bonjour à vous. J'aurais une question à propos de la cadence de livraison, mais tout d'abord, j'aimerais ça qu'on se penche sur la baisse des cas, des hospitalisations, des décès, tout ça. Qu'est-ce qu'on peut dire à propos de la troisième vague? Est-ce qu'elle est terminée? Est-ce qu'on est sur un plateau entre deux événements? On en est où actuellement, là, selon les tableaux que vous avez en rapport aussi avec les autres vagues qu'on a eues, là?
Merci pour la question. C'est Dr. Njoo. Peut-être moi, je peux commencer. Oui, si on regarde la courbe épidémique avec des données les probantes et les cas signalés par les provinces et territoires, je pense que les tendances sont vraiment dans la bonne direction. On peut dire qu'on est sur la pente descendante de la courbe épidémique. Et c'est sûr que les indicateurs tardifs comme les hospitalisations, aussi les décès, les chiffres aussi ont diminué. Ça c'est toutes les bonnes nouvelles, mais comme on a vu déjà avec notre expérience entre la première et deuxième vague et troisième vague, et c'est toujours quelque chose à suivre. Il faut toujours rester prudent. Si on commence à assouplir peut-être trop rapidement les mesures sanitaires, on est toujours à risque de peut-être avoir une quatrième vague. Ça va bien maintenant avec notre déploiement de vaccins, les programmes de vaccination, mais il faut toujours continuer avec les mesures sanitaires et assouplir, d'après moi, les mesures sanitaires au fur et à mesure avec beaucoup de prudence et toujours en surveillant, en regardant c'est quoi les données probantes concernant la transmission dans la communauté, assurer que le personnel de santé publique est en une bonne position comme on dit, dépister, faire le traçage des contacts aussi, isolement et aussi quarantaine des cas signalés aussi les contacts. C'est toujours la base, la priorité pour la santé publique. Mais je pense que oui, on est dans une bonne position. On ne sait pas si on vraiment avec un plateau, je pense qu'on est sur la pente descendante et j'espère si on continue avec les mesures sanitaires aussi, le déploiement des vaccins, on va vraiment continuer à descendre sur la courbe épidémique. Merci.
Merci. À propos de la cadence de livraison, elle n'a pas cessé d'augmenter au cours des dernières semaines, des derniers mois. J'aimerais savoir on va avoir atteint le fameux 75 %, ça s'en vient. Est-ce qu'on continue à accumuler des doses? Bon, comme disait Dr. Njoo tantôt, pour atteindre, on l'espère, le 100 %. Est-ce qu'on accumule pour une troisième dose? On continue à recevoir pour renvoyer à COVAX. On baisse les livraisons. Qu'est-ce qui va se passer là, quand on va avoir atteint notre objectif et même l'avoir dépassé?
Merci pour la question. Moi, je peux commencer, mais je suis aussi céder la parole à le Brigadier-Général Brodie, aussi à Mme Paquette. Je pense que le but était toujours d'offrir la vaccination au complet, ça veut dire les 2 doses, à tous les Canadiens et Canadiennes admissibles ici au Canada. C'est d'ici la fin de l'été, je pense que peut-être mois d'août ou peut-être même septembre, mais je pense qu'on est sur la bonne voie. Ça, je pense que ça reste toujours notre objectif. On parle de, comme vous avez dit, le 75 Je pense que ça, c'est comme une jalon, c'est quelque chose, OK, si on a 75 de la population au moins vaccinée avec une dose et 20 avec les deux doses, c'est une bonne signal peut-être pour commencer à regarder est-ce que c'est possible d'assouplir les mesures sanitaires. Mais c'est sûr que pour tout le monde dans le domaine de la santé publique, on veut même plus que 75 de toute la population vaccinée avec les deux doses. Ça reste toujours notre but, notre objectif au total. Moi, j'espère que c'est possible de même vacciner avec les deux doses 100 de la population. C'est toujours quelque chose, je ne sais pas comment on dit ça en français, mais Dr. Tam a dit shoot for the stars. Donc, on continue avec notre bon travail.
Oui, et comme vous avez constaté, la situation évolue et donc nous continuons de surveiller, évaluer les besoins futurs. Et comme on a mentionné un peu plus tôt, cela inclut des dons, mais plus de détails sur ce sujet va être annoncé plus tard. Merci.
On a fait les rencontres bilatérales la semaine passée avec toutes les provinces et les territoires et on a discuté leur capacité de faire les vaccinations en comparaison de la quantité de vaccins disponibles. Et c'est clair qu'il y a une grande capacité de faire la vaccination et on peut faire une bonne coordination pour bien matcher la disponibilité de vaccins et la capacité de faire les vaccinations pendant les jours, les semaines et les mois qui viennent.
Merci beaucoup. Thank you. Next question.
La prochaine question, our next question, Mike Lecouta, Global News. Your line is open. À vous la parole.
Good afternoon. Thanks for taking our questions. I wanted to ask about the donations, and I know that you don't have a lot of information, Madame Paquette, but for you, possibly Dr. Tam and Dr. Njoo in this question, how could it affect our own rollout? I know in French, Dr. Njoo, you seem to mention that you want to make sure that all Canadians get both vaccines before we start donating. Is that the case? Is Canada only going to start donating vaccines to other countries once we hit certain vaccine milestones in our own country?
It's Dr. Njoo. Maybe I can start because you put the question. I think that to be quite honest, I think that there are sort of two tracks, but as they say, I think we can walk and chew gum at the same time. The fact is that delivery of vaccines are coming to Canada, and we're well on track to be able to offer the 2 doses of vaccine to every Canadian that's eligible for vaccines. And I think certainly we're looking towards the end of the summer if our planning and the logistics all go well. And at the same time, certainly, I think other government officials are obviously in discussions, including obviously our senior political leaders in terms of what Canada could be doing at the global level. So I think in some ways it's not one or the other. It's really I think both things are happening at the same time. So I'll leave it at that, and certainly turn to my colleagues for any additional comments.
I would say that I agree with Dr. Njoo on this, and I just want to reassure you that Canada did secure more than 400 million doses of its of vaccines and vaccine candidates. So we are in a position where this is possible, but we're also I want to just assure you that it will not impact our objective of fully vaccinating all Canadians by the end of September.
No one else wants to weigh in? I can go with a follow-up. I'll take that as a yes. So, Dr. Njoo, you also mentioned timelines of fully vaccinated, and Dr. Tam has talked about shooting for the stars. So based on the numbers of vaccines that we're getting in the country and how quickly we are we looking at changing our goalposts right now and aiming for a 2-dose summer rather than just a 1-dose summer and a 2-dose fall?
It's Dr. Njoo. Maybe I'll start and then certainly turn over to Dr. Tam. I think what you're referring to, I think, is what our Prime Minister said. And I think it's nice, it's simple in terms of what the Canadians can look forward to. But I think, in my view, certainly what we're seeing in the past several weeks, but also what we can look forward to based on the sort of the supplies of a vaccine coming in, and also how provinces and territories are ramping up their vaccination programs. That yes, I think hopefully we can accelerate and have many more Canadians receiving their 2 doses of vaccine. By sort of late summer and maybe even earlier. Who knows? But I would say that one of the things that's still unknown is that it's always easy. You can look at the trends. Okay, everyone's got their 1 dose, and we're going for the 2 doses. But I think, as we talked about earlier, the first 60-70% might be easier to administer the vaccine, and we've seen that experience in other countries. Hopefully, Canada, we're not going to follow those other countries where they were able to vaccinate quite quickly. The 60-70% of the population. And then they start plateauing, because it's always harder that last few percentage points in terms of the part of the population that might be a sort of a more vaccine hesitant, or let's say maybe also in terms of accessibility. So we're looking at that carefully, and we're obviously collectively looking at how we can address issues of accessibility, but also vaccine hesitancy. So I would say that we can't necessarily rely on sort of the good trend up to now, and just expect that it will continue just because we've done so well so far. But certainly, I think that if everything goes according to plan, that hopefully, I would say that instead of saying okay, all Canadians might be fully vaccinated by the end of September. Hey, if everything goes well, I'm optimistic. Maybe it'll be sooner. But like I say, the goal still officially is obviously offering all Canadians their full vaccination by the end of September.
It's Theresa Tam. I would say that we're always trying to be, planning ahead and being precautionary. Of course, we will want the 2 dose faster. But I know that with the provinces and territories, I think all Canadians, it's until Brigadier-General Brodie gives you the absolute delivery time that people are still, concerned. So I think this is the pattern that we've seen. You can say, well, here's the projected delivery, until you've seen that, spreadsheet with a solid number on it, and actual commitment. We can't say for sure, but based on what we had initially planned for, then it's possible that you could get 2 doses earlier. The other thing, and why I say go beyond the initial modeling estimates for safe opening. And that's based on not overwhelming your hospital system, not based on no cases. But it is that if we get variants more transmissible, and if we get variants that evade the vaccine immunity, even by a little bit, it's much better to shoot for higher. In that way, you can be much more reassured that the hospital systems won't be overwhelmed. But because of the Delta variant, I am advising caution, particularly in between the first and second doses in terms of the population coverage. And I totally agree with Dr. Njoo that the last kilometer, well, actually 2 kilometers, if I've ran marathons before, the last 2 is horrible. If you've got to, just keep looking at that finishing line and trying as hard as you can to get there. But we know we will. We know we'll cross that finish line. That's what I hope for everyone. But I think part of it is that the variance makes me want to tell people that people should go higher for sure.
I would just add, it has been my life's work to deliver essential supplies to people that need it at the time and place that they need it. And to do that now with vaccines, with COVID-19 vaccines for Canadians, is really, I think, a tremendous testament to the collective effort that has brought us all to this moment. So if we look now, in the next 2 weeks alone, there'll be over 14 million doses, and we have solid supply projected throughout the month of July. So if we can ask Canadians like now to step up and step forward and do your part in that enterprise to be fully vaccinated as soon as possible, as soon as those schedules allow, then truly this is how we will lead ourselves through this pandemic as Canadians.
Thank you. The next question will be the last. La prochaine question sera la dernière.
Thank you. Merci. The last question, la dernière question, Stephanie Levitz, the Toronto Star. Your line is open. À vous la parole.
Hi, thanks for taking my questions. The first one, Dr. Tam, I wondered if you could just give an update on where Novavax is in the approvals process for Canada.
I actually can't. We don't have the Health Canada colleagues or regulators on, so we will have to get back to you on that answer. Sorry about that.
Okay. And my second question has to do with the ongoing discussions to plan for a rollback of restrictions at the border. Lots of folks seem to be a bit panicky because children under the age of 12 can't currently receive a vaccine. And so there seems to be a lot of concern out there. What's going to happen with kids? Are we going to have to evolve public health guidance for children who can't be vaccinated? They don't have access. Will they have to quarantine? I wonder if you could share, Dr. Tam, some of your thinking, if there is any ongoing, about how to manage that issue as we get further along in the vaccine process.
And you're talking specifically about the border in terms of the
let's focus a bit on the border. Yeah.
So obviously, right now, vaccines. One vaccine's approved for, I guess, youth or adolescents, 12 years or older. Obviously, younger kids can't be vaccinated. And so I think, the first rule of thumb, if you like, is that, of course, kids can't be separated from their parents. The current construct is that anyone who's coming in who has the right to enter Canada will take a pre-departure test. So everyone has to do that. And then the vaccinated individuals are exempt from the government-authorized accommodations, knowing that they've been fully vaccinated and have had that pre-departure test. I think if you had minors within a group of families, then I think the current thinking is that they're all then exempt from the government-authorized accommodations. And they will then move on to obviously get the arrival test and wait for the results. Now, anyone who is unvaccinated will have to stay in quarantine for longer and get the day 8 test. So there may be some differential protocols for vaccinated and vaccinated group members or in that family. But we'll make sure that those questions and answers are provided. But there is no intention to separate children from their parents, of course. And I do think that children in general have had milder illnesses and have been, at least to this point, seem to be less of a key role in transmission. But we're always watching that really carefully. So that's the current thinking, and we'll have obviously have to answer those detailed questions in the days to come. Does that help?
Thank you.
Yeah, thank you very much.
Thank you, Dr. Tam. That will be all for today's news conference. C'est ce qui met fin à la conférence de presse pour aujourd'hui. Merci d'avoir été avec nous et bonne journée.